month is National Minority Health Month. It's a month dedicated to raising awareness of health disparities that continue to impact racial and ethnic communities. We at iPrevent are dedicated to raising awareness, addressing and alleviating health disparities in the New Orleans community, particularly when addressing substance use, HIV, and Hep C rates among youth.
So we took to the street and asked people a few questions in regard to National Minority Health Month.
They can't afford health insurance, stuff to that nature.
Yeah, because things are too, like, hospital bills are too expensive for some people, and most people don't have Medicaid and stuff like that.
What are the barriers that impact the health care in New Orleans? I would like to see insurance. Is one a big barrier. I think stereotype. They probably give certain treatment to certain, patients that look like they're able to afford the care. Another barrier, I just think a lot of people just can't afford it.
Barriers that impact healthcare in New Orleans. There's not enough information out there to get healthcare with New Orleans as a whole. Like, you could go on Google and they'll have you go to different websites just to find one healthcare. And even on websites, you don't get enough information. I feel like it's important to celebrate National Minority Health Month because minorities as a whole are frowned upon. Like, we're frowned upon in everything. Everyday life, you hear something bad that's happening to a minority. So for us to celebrate our health and then from the jump, from the day we're born, we already have bad health. So it's good to just enlighten the importance of our health.
A lot of mental ill people running around, so that's to help them out and let them know someone is out there to help them, to reach them, to give them the help that they need.
Because everybody wants some type of recognition, knowing that they're doing something that's worth it, people just like feeling good. I mean, everybody just want to be equal. That's what I think about it. I'd like to see in the next few years when addressing these healthcare issues in New Orleans is an improvement. The wait time in the ER is ridiculous. I done been in the emergency room 14 hours for a Band-Aid. You know what I'm saying? So I think it's a lot of stuff that you have to look into when it comes down to healthcare. That, I think, the number of people that allow for you to check in, because a lot of people in the hospital, they don't get better until their family can come around and stuff. So there's a lot of stuff dealing with healthcare that I would want to see change.
Pay less. I feel like you shouldn't have to pay so much just to take care of your health.
Well, they just get a little better, and it can help more people get the medication that they need and help them get the help that they need to keep them off the streets and hurting themselves and other people.
Yeah, and so that it won't be so high for people to get medicine and stuff like that. So it could make it easier for them to get medicine.
You have a place that can help them be in, so when they need the help, because everything is so far off for that, for as mental health. They don't really have a place here in New Orleans to hold them.
It is essential that we continue to work towards a day that all individuals have access to quality health care, that all individuals have access to quality housing, jobs, education, regardless of their gender, sexual orientation, race, religion, and so on. We celebrate National Minority Health Month in April. However, it does not end in April. It is something we should work towards every day. So share with us what you work towards preventing with the hashtag iPrevent.
Here are some things our staff are working towards preventing.
I aim to prevent the stigma on mental health. This stigma is also accompanied with prejudice and discrimination, which often leads to delayed medical treatment, which can affect overall health outcomes in the future.
I prevent stigma against individuals living with HIV or any STD.
I prevent discrimination occurring in the healthcare system because of someone's ethnicity, race, religion, sexual orientation, or gender. If I see it, I call it out, and work towards developing trainings and policies to protect marginalized populations. Thanks for watching, and leave us comments on what you want our next video to be about. Always feel free to ask questions in comments or shoot us a message.
Don't forget to follow us on Facebook at iPrevent OHL and Twitter, Instagram, and Snapchat at iPrevent_OHL.
Don't forget to download our app. It's now available and free for Androids and iPhones. Just go to the Google Store or the App Store and search iPrevent OHL.